Hello, my name is John Omaha, and I want to talk today about parenting and some aspects of parenting that are vitally important to raising children and that impact who we become, who people become as adults. And I see these issues in my therapy practice with with adolescents and adults all the time. And so we're going to talk today about some fundamental aspects of parenting. One of the things that I take a thorough history with all of my clients. And one of the things that I notice is there's a correspondence between whether the client was breastfed in childhood, in infancy or not, a correspondence between that and the challenges that they're having in their adult life. Very important to get this part. Challenges like an eating disorder, like a sexual compulsivity disorder, like anxiety, like depression, like drug addiction, those are symptoms. They're symptoms of a deeper problem. And in the work I do, we try and get to the problem through an understanding of the symptom. But what I want to talk about now is what happens for the child who is breastfed. And by the way, I never mean to blame parents, mothers, for not breastfeeding their babies. I'm only calling attention to the fact that there are consequences. Sometimes babies are born prematurely and mother can't breastfeed them. There are workarounds. So let's talk about this now. Attachment is both an emotion and a behavioral paradigm. Psychologists have focused since 1960 on the behavioral piece. It's also an emotion, which we'll discuss in a subsequent video here. Attachment is a bond between the mother and child. And as Alan Shore and many others have called attention, that bond begins with the baby gazing into mom's eyes from the 14 inches between mom's eyes and the baby's eyes when the baby's being breastfed. And baby feels held, baby feels comforted, baby feels soothed and in that situation, and baby feels nourished, and also, very importantly, baby feels held, and baby then learns the boundaries of his or her little body. And these translate into young adulthood and adulthood. And when people who present in young adulthood or adulthood with eating disorders, for example, I often find that they were not breastfed in childhood. And for whatever reason, all I'm saying is that then nourishment becomes a challenging issue. We'll talk in another video about the importance of the unconscious and unconscious processes. This is one of the fundamental ones. Children learn, they don't formulate this in words because the part of the brain that makes narratives isn't well formed until fourth or fifth year of life. So they don't have a narrative story, and yet they have a knowing, an awareness, if they were breastfed, that they're not going to be nourished. And so they are always concerned with food. Now, often and they may well eat too much because they believe, again, an unconscious motivation, that there'll never be enough. Often they were also their weight was talked about, was criticized in childhood and adolescence, compounding the problem. So attachment, as we'll see in the next video in this series, is an emotional response. And I'm going to tell you how to find that sensations that accompany that response. It goes along with another piece. All parents will say, I love you to their children. what's really important is a separate phenomenon that I call and others call mattering. Mattering is when you pay attention to the child. Like I'm paying attention to the camera right now. It has my full attention. I'm not looking to the side and I'm not looking at my cell phone. I am not doing anything but paying attention to my audience out there. That's what children need. That's what mattering is. And it's irrelevant if parents say, you know, I love you, but they're looking at their cell phone at the same time. Or if they say, you know, I love you, and but they're headed out the door to do something, go drink in a bar with their pals, or whatever else they do. Children respond to mattering, to receiving the full attention of the parent, and caring and paying attention to what the child's needs, and being sensitive and attuned to the child's needs and emotional states. So that's the basis for our understanding of parenting. Thank you very much.